For decades, the story of mental health care often involved being sent away to some distant, isolated institution. But what if we flipped that script entirely? What if we brought the care to the people, right in their own neighborhoods? Well, that's the powerful idea behind community psychiatry, and it's nothing short of a revolution. So let's dive in.
All right, so here's our game plan. First, we'll look at the absolutely staggering gap in mental health care that made a new approach so critical. Then, we'll explore why community psychiatry is considered a true revolution in the field. After that, we'll see how India took this idea and turned it into a massive national plan, what that actually looks like at the local level, and finally, how this whole movement fits into a global call to action.
So, to really get why community psychiatry was such a game changer, you first have to understand the sheer scale of the problem. And we're going to start in India, a country with over 1 billion people where the gap between who needs care and who can get it is just immense. This number, wow, this one number says it all, 0.2. In India, there's just one psychiatrist for every 500,000 people. Can you even imagine that? The wait times, the travel, the near impossibility of getting help? This one statistic just lays bare a system that's stretched way past its breaking point. And this table really paints the bigger picture. We're talking millions upon millions of people dealing with severe mental illness. But the resources, they're incredibly scarce. You've got about 3,500 psychiatrists and only 26,000 beds for the entire country. And look at the numbers for psychologists and social workers, even lower. So the main takeaway here is obvious. The old-school hospital-based model just couldn't work. There was no way. A new idea was desperately needed. And that new idea? Well, it was so groundbreaking that it's now seen as the fourth major revolution in the entire history of psychiatry. It was all about completely rethinking where and how care is delivered. It was about taking psychiatry to the people instead of making people come to it. So what exactly is community psychiatry? Well, at its heart, it's a model that says mental health care belongs right where people live. It's got to be comprehensive, so everything from prevention all the way to treatment. And its biggest goal is to support people in their own environment, which makes hospitalization a last resort, not the automatic first step.
And to really appreciate how massive of a deal this is, just look at the company it keeps. The first revolution separated mental illness from things like sin and witchcraft. The second, led by Freud, gave us psychoanalysis. The third brought us modern medications that could finally treat symptoms effectively. And then comes the fourth, community psychiatry, which changed the entire system of how care is delivered.
You see, this approach is built on some really solid principles. It's not just about changing the location, it's a whole new philosophy. It means taking responsibility for the mental wellness of an entire local population, using a whole team of different professionals, making sure care is continuous, and, this is huge, focusing just as much on prevention. Okay, so you have these powerful revolutionary ideas. Awesome. But how in the world do you turn them into a reality for 1 billion people? Well, back in 1982, India launched a national blueprint for change that was going to try to do exactly that. This was the National Mental Health Program, or the NMHP. Launched in '82, it was this incredibly ambitious plan to completely rebuild mental health care by weaving the principles of community psychiatry right into the national health system. And the program had 3 really clear, really powerful goals. First, make sure everyone could get at least basic mental health care. Second, integrate mental health into general healthcare. Stop treating it like it's this separate, siloed thing. And third, get the community involved, empowering people to actually participate in their own care. The NMHP was then broken down into 3 key action areas. Treatment was designed as this multi-level system, starting with basic care in villages. Rehabilitation was all about long-term support. And the prevention part tackled specific, widespread issues like addiction. It was this really comprehensive strategy meant to work from the ground up. Look, a national plan is one thing, but making it work on the ground where the rubber meets the road, that's the real challenge. And the key to the NMHP's whole strategy was focusing on the district level, the administrative heart of local communities. And this led to the creation of the District Mental Health Program, or DMHP, back in 1995. This was basically the operational arm of the national plan, designed to bring all those ambitious goals to life in every single district across the country. So this is the crucial point. This is the core insight. The role of the district psychiatrist was completely reimagined. With such a massive shortage of specialists, you just can't have them seeing patients one-on-one all day. So instead, their main job became acting as a force multiplier. They would train and supervise local, non-specialist health workers to handle the basics. This way, a single psychiatrist's expertise could cascade throughout the whole community, reaching way more people than ever thought possible. Genius, right? Now, what's really interesting is that India's approach wasn't happening in a vacuum. It was part of this growing global agreement that mental health needed a totally new direction. And this all came to a head in a landmark report from the World Health Organization.
The report's slogan was so simple but just so powerful. Stop exclusion, dare to care. It was a direct challenge to the stigma and isolation that had defined mental health care for centuries. It was a call to arms, really, to embrace these community-based, compassionate models of care.
And the report made it crystal clear why this matters to every single one of us. It revealed that 1 in every 4 people on the planet will be affected by a mental health condition at some point in their lives. This isn't some niche issue affecting a few people over there. It's a universal human experience, and it demands a universal response. So the WHO laid out 10 key recommendations for action, which pretty much became a global blueprint. And as I read them, notice how closely they mirror the principles we just saw in India: providing care in primary settings, giving care in the community, involving families, educating the public, all of it. This wasn't just a theory anymore. It was a global endorsement of a revolution that was already proving it could work. So moving care from those isolated institutions into our own neighborhoods was the 4th great revolution in psychiatry. It has changed millions of lives. The principles are clear, the blueprint is there. But you know what? The work is far from over, and this leaves us with a really critical question to think about. After moving care into the community, what is the 5th revolution in mental health, and how do we make it a reality?